With a family history of heart disease called restrictive cardiomyopathy, Christal Shiller knew at a young age that the disease had been passed along to her.
The heart muscle is kind of deteriorating, and it affects the way that the heart fills and pumps blood into your body, so you're not able to get the blood that you need.
Christal also knew that somewhere down the line, a heart transplant was key to her future.
My mother had the disease, and she died when I was 8 years old. My aunt, her sister, also had the disease and passed away at a very young age. She was 41. My sister, who is 3 years younger than myself, had it. She received a heart transplant, and my aunt's daughter also received a transplant at Ohio State.
Symptoms of the disease started appearing when Christal was in college, and as she aged, her condition progressed.
The easiest way for me to describe it is I would avoid parking far away from places because I knew that I couldn't breathe from the time I got out of my car to walk into a store. Or if somebody said, we need to go upstairs for something, we'll just take the stairs. In the back of my mind, I can't take the stairs because I wouldn't be able to breathe. And it's hard to explain.
Yet doctors at the Ohio State Wexner Medical Center treated Christal and her symptoms as best they could to hold off transplant surgery as long as possible.
But the team at Ohio State, so they were able to kind of prolong my life that way. They were giving me the medications that I needed and kind of doing the procedures that were necessary to help get me further along, which was nice.
The day came, though, when Christal was 40 years old, that a transplant was needed.
It wasn't a surprise, no. It's run in the family, and so even though we knew it was a possibility, and it is a shock initially, I think, but we knew it was coming. So in that sense, we kind of expected some things, had some experience with it. So I saw the team at Ohio State at the Ross Heart Hospital. They prepped you very well for that. They answer all the questions even before you ask them. They could tell you what to expect. And so seeing that team up into transplant time helped.
It's been a year since Christal's transplant at Ohio State's Comprehensive Transplant Center, and her life is moving full speed ahead. And Christal is doing her best to keep up with her daughter.
I can go out and walk far distances, and I don't have to worry about where I park, and I can go up flights of stairs, and I don't have to worry about trying to go up two. There's the medication that you have to take, the anti-rejection medication on a daily basis. You have to watch certain things that you eat and take care of yourself. I mean, I've been given a great gift, and so just doing those things is necessary to make sure that the heart stays good and your body doesn't reject it.
The medical professionals at Ohio State have also assisted Christal and her family by providing genetic testing. It's one more tool for patients with a family history of heart disease to manage their condition.
I was able to get genetic testing done at Ohio State so that way we're able to know if my daughter has it. Our family's been able to use it in terms of, I have other cousins who have children, and so that they're able to use it as well. So genetic testing obviously helps in people at least being able to prepare for something like we have in our family.
And her advice for those patients on the transplant list?
People who are waiting, just know that there are people out there willing to give the gift of organ donation. Work with your teams, do the things that you can to keep going, and things will work out for you as well.